I've come in from a private sector background into the NHS. One of the things that I noticed quite quickly was that there is a legacy of putting solutions in place first and then expecting the problem to be solved as a result of that, putting that solution in place. The question I found myself asking all the time was, what's the problem we're actually solving with this piece of technology? I think that's probably the biggest issue, is that in the private sector you are basically held to account for positive business cases, for benefits to be realised, whereas it felt to me when I came into the NHS there was a few examples where we were putting solutions in place, or solutions already in place, where I just didn't understand why we were doing it, what the positive outcome was that we were expecting to see from that. It was more around just ticking a box. For me, there's two sides to the technology enablement of the workforce. Part of the work we're doing on the Building a Digital Ready Workforce initiative that I'm part of is that we've understood that people create great technology. There's no end of great technology out there. I think Karen was speaking earlier about the fact that we spend huge amounts on getting the technology right, and we spend virtually nothing on on implementing it and enabling it properly. I think that, for me, is the key piece of work that needs to happen, is we need to become proficient at change. We need to become proficient at understanding the people impact of change. And the Leadership Academy very, very much has been about bringing the enablement of technology in-house. So recently we've taken for our two main programs, the NIBEBN program and the Elizabeth Garrett Anderson program, we've brought the virtual campuses in-house. Now that's saved many millions of pounds, because before it was being provided by a large consultancy, and it just wasn't efficient, it wasn't really meeting the needs. So we've now had our first blind participant, for example, on the NIBEBN program. With the old campus, we couldn't have even offered the program to them. Now we are actually building inclusive platforms to actually access our programs in the same way as anyone else. That's critical for me. That level of inclusion is absolutely something that we should always be aspiring to. And I think there's been a glass ceiling imposed on the CIO roles throughout the system, certainly within the NHS, where you don't tend to see CIOs at board level. So if you keep them away from board level, you don't get the true integration of the technology understanding embedded in our boards, and they're the people who are accountable for making things change. So we've kind of created this gap. And we've kind of created a competency gap at board level as well with the CIOs, because they're not getting there. So I think that piece of work is critical. That's another piece where the Leadership Academy is now looking at that, particularly spinning off the back of Topol, is to try and understand how we bridge those gaps so that we have boards that are capable of being accountable for technology in a way that they're not now. They tend to push it away. They push it down to the sort of associate director levels and expect them to sort it out. So I think there's a great opportunity there just to explore a different way of operating, maybe.